Hi, my name is Dr. Ami Dakshini and I'm a dermatologist. So, hair loss is a complex phenomenon and there is no one size that fits all. It's important to understand that we need the early diagnosis and the right personalized care to see that we can increase hair growth and we can prevent it from continuing further. For this, we need to understand the causes of hair loss. Now, hair loss can be one hormonal, where we call it the androgenetic alopecia. It could be the male pattern seen in men and the female pattern in women. Now, male pattern essentially you start noticing hair loss or hair thinning from the temples, which goes up to the crown and then the central part of the scalp. In women, we notice that the midline starts increasing and expanding, and you start noticing hair thinning. This is your androgenetic or hormonal alopecia. The second cause is autoimmune, where you notice something called alopecia areata. This signifies just coin shaped hair loss patches on the scalp, sometimes even in the mustache, on the beard, and other hair containing areas. It could spread across the entire body, causing, alopecia universalis. So, this is another cause of alopecia. The next could be nutritional or stress induced. It's a lifestyle cause of alopecia called telogen effluvium, where the hair starts shedding from the entire scalp and the hair starts thinning. So, this could be due to stress, could be due to post pregnancy where hormones again change, or could be due to nutritional causes. And the last is hair loss because of our lifestyle or because the way you tie your hair. It's called tractional alopecia, where if hair is tied too tightly or hair extensions and hair pulling habit is there, it can cause patchy hair loss, which, if not treated early, can cause scarring and then irreversible hair loss. Now, hair loss basis the cause can be treated accordingly. Let's look at androgenetic alopecia or hormonal hair loss. The gold standard for them is minoxidil. Now, how does minoxidil work? It is a very simple agent. When applied to the scalp, it improves the blood circulation to the scalp, thereby aiding more repair, getting more protein and nutrition to the hair follicles. What it also does is it keeps the hair more in the anagen or the growing phase of the scalp, thereby the hair looks much denser, thicker. It also helps other ingredients penetrate better, like finasteride or your peptides penetrate much better, giving us better result when used with minoxidil. The other line of treatment is oral, especially in androgenetic alopecia, depending on the cause. So, oral finasteride or dutasteride, or in women, where we reduce the hormone level testosterone by giving either a spironolactone or contraceptives, can help in reducing hair loss and promoting hair growth. In alopecia areata, we just need to reduce the local inflammation or advanced immune state of that particular area. So, the best line of treatment is corticosteroids, either injected or topical. Also, now we know that JAK inhibitors also help when taken orally or applied in alopecia areata conditions. Do consult with your dermatologist before you go ahead with any kind of application. And in cases of telogen effluvium, it's important to understand the cause, because if it's excessive dieting or restrictive diets, or it could be postpartum, it's important to find the cause, the trigger, and treat accordingly. So, home care remedies also help in controlling the hair loss, but generally not in helping regrowth. What works well is rosemary or castor oil. You can use methi seeds or leaves or oils which contain antioxidants like the hibiscus or the curry leaves or the methi leaves, where coconut oil is brewed with that and used on the scalp. It's a great hydrant, great moisturizer, prevents breakage of the hair and nourishes the scalp. When you massage this, the entire process of massaging improves the blood circulation, thereby helping repair. But you need to remember that these are just supportive measures. And if you notice excessive hair loss, it's important to go to your dermatologist and find the cause. The next is whether hair loss, the final treatment or the permanent treatment for hair loss is hair transplant. I agree. The only permanent treatment for hair loss is hair transplant. But before you go and just directly go ahead and do it, you need to remember a few things. Hair transplants can be two types. It can be just the follicular unit, where each follicle is removed and replaced, or it could be a follicular strip, where an entire area from the donor site has been removed and replaced. It's not always going to work, so you need to be patient, and you should be aware of it not happening or not doing well and go for a repeat session. The next thing you need to remember with hair transplant is that it takes almost 6 to 8 weeks to start seeing initial results, and you need to apply your topical stimulants, your peptides, and sometimes even your minoxidil to prevent further hair loss in areas which are natural. But yes, hair transplant is the only permanent cure for hair loss.